Welcome back. This is Dr. DeShavo with Chapter 2, Part 2, continuing with the immune system. So far we've looked at the structure of the immune system. We've seen that the lymph nodes, the lymph vessels, the spleen, the thymus, and the blood all contribute to our immune system. And we have looked at cells and physical barriers, which provide that innate immune system that we've been born with. Now we're going to look at adaptive or acquired defenses. When you get exposed to an illness, your body builds up defenses that are very specific and cause a quicker response in the future. So for example, if you're exposed to a cold and you get sick, usually you're sick for about 10 days because that's how long it takes your body to develop the antibodies to that antigen. If we're exposed to that cold again and we get over it quicker, we have some sort of memory cell that's living in our system that goes, oh, I know this, I can fight this off, and it can do it in about 5 days. So this adaptive acquired defense system that we've developed over time uses a memory system going down this checklist in order to remember illnesses and to be able to destroy them quicker. And it can tell self from non-self in between pathogens. So it's just a tad smarter. And don't think that innate defenses are not smart. I think they're fascinating that we are born with these systems in place that amazingly defend us from all these viruses and bacteria in our environment. Now, before you watch this or right after, I'm going to include a couple of videos about these adaptive acquired defenses. It says everything that I'm going to say, but a little bit different. And once again, whatever I test you on will come right from these notes. But sometimes I think it's helpful to hear these things a couple times. I feel the immune system, especially this part of the immune system, is extremely challenging. So I want to give you a couple different tools to learn the system over the next week. And as always, if you have any questions, shoot me an email. Now, when we're looking at these acquired defenses, these will be cells that create memory cells that will be able to respond to infectious agents quicker if they reinfect us. What we're going to look at here is T cells and B cells. The main goal of T cells is to destroy cells directly or stimulate B cells. The main goal of B cells is to provide what's called humoral immunity, which is where we get antibodies. And we're going to break this all down for you. Let's look at what they call cellular immunity. And it's cellular because the T cells are the direct cells that are involved with this system, as opposed to B cells are considered humoral because they release antibodies into the humors or the tissues of the body. That's why they call them different things. And these T cells are called T cells because they actually mature in the thymus. The thymus is a little fatty pad that's right behind your sternum. It's not made up of fat entirely, but it looks fatty if you were to look at it. And that is where these T cells mature. Now, there's different types. So a T helper cell activates B cells. So that is going to help the B cells to produce what are called antibodies or immunoglobulins. And we build up these antibodies over time. And I'll tell you what those antibodies do in a little bit. But they provide several means by which we can kill infectious agents. Now, T suppressor cells turn off that antibody production because we don't want it to go awry. We can actually have disease processes where we release too many immune cells, and that starts to destroy the tissues of the body. These T suppressor cells help to keep the T cells in check for that exact reason. Killer cells. I love that name, killer. It's like, got a killer dog with, got these killer cells on a chain. Cytotoxic T cells will actually directly destroy the infected cells by destroying the cell walls. And I always remembered this in a stupid way, but I'm going to share it with you. I always imagined these were the cells. Sorry, I can't draw very well. And then the T cells, I always imagined coming in and poking holes because they look like T's, almost like they're a little, I don't know, knife or something. And these cytotoxic T cells literally punch holes in the bacterial, the viral, or the fungal walls or cancerous cells. And what that does is that induces apoptosis, and that cell will let in too much fluid and electrolytes. It won't be balanced anymore, and it'll actually break down. Kind of a cool little process. T cells primarily fight against viruses and cancer for the most part, but don't forget they're also going to stimulate those B cells, which will provide many functions as well in fighting off bacteria, viruses, cancer, fungi, etc. Humoral immunity, once again, is going to be the B cells, and they called it humoral because the humors, or the fluids of the body, is where we will find these antibodies that B cells create. So B cells will be stimulated by encountering an antigen, and an antigen is simply some infectious agent. Something has gotten into our body that our body doesn't recognize, and these B cells go, wait a minute, this is wrong. So do T cells. This is wrong. And they start to do what they do. And the T cells, they undergo those different T cell steps that we talked about. T helper cells will stimulate B cells. Suppressor cells will keep it from going crazy. Cytotoxic T cells will actually destroy the cells. And then the B cells kick into play when they encounter this antigen and start to create antibodies. They also create memory cells. So these B cells are made and mature in the bone marrow. I've also read that they'll mature in the spleen and the lymph as well, but they're called B cells because they mature in the bone marrow. Thank God something makes sense. And that's what we'll go with, but I just put a little sidebar there that they mature in the spleen and the lymph. And they're also found in the spleen and the lymph nodes. They will differentiate once they're created into memory cells or immunoglobulin secreting cells. Okay, so memory cells will take the memory of that antigen or infectious agent, and they step aside and they keep the memory of it. And that memory helps, if we're ever infected again, to create new antibodies against it. That's part of how B cells function so quickly to an infectious agent that we've been reinfected with. T cells actually have memory cells too, but they don't talk about it much in your book, but just as a sidebar. Okay, so B cells, memory cells, keep the memory of that antigen, take off, hang loose, and then if it ever comes back, they can create antibodies quickly against it. There's also immunoglobulin secreting cells. These are called plasma cells or effector cells. Okay, so plasma cells or effector cells are B cells, one of the two types of B cells that we create in the bone marrow. And these are the actual ones that will create immunoglobulin. I know I'm repeating things. Let me tell you why. I feel like this is one of the most complicated chapters, so I'm going to try to just keep putting things together for you and repeating it, because I find that helps me to think about it. And I would also suggest after every slide, pausing it, reviewing it, and then maybe reviewing this lecture a couple of times, because I find it's a little confusing. Back to B cells. So these B cells will differentiate into two types, memory cells and immunoglobulin secreting cells, which are also known as plasma cells or effector cells. Now, these plasma cells or effector cells will secrete immunoglobulin, which acts as our antibodies. Some people use that interchangeably, immunoglobulins and antibodies. And there are several different types of immunoglobulins that have specific functions. Now, antibodies are produced approximately 72 hours after the initial antigen exposure. Excuse me. Usually it'll take about 5 days for your, 10 to 15 days, I'm sorry, for you to actually get over that cold though. So even though they're produced, they're not, highly functional the first time around. Second time around, they're usually functional by the 5th day. They may even protect enough after the second exposure to something to prevent it altogether. Okay. So they protect against bacterial, viral reinfection and immediate inflammatory responses. Now, each B cell has a receptor for a specific antigen. Okay. And then we have that quicker response. Okay. So we have, with acquired immunity, T cells, which have that direct response, 3 different types, which we spoke about, primarily fight against viruses and cancer. We also have the humoral immunity, which is the B cells. B cells create memory cells, so we remember how to fight off that antigen, and also antibody producing plasma or effector cells that will provide antibodies to fight off the present infection. Here's a picture that shows that both of these cells, the T cells and the B cells, are created in the bone marrow. And then T cells will go over to the thymus to mature. B cells will stay and mature in the bone marrow. As I said, some people say spleen or lymph nodes, and some of them probably mature in the bone marrow and the spleen and the lymph nodes. There's probably varying degrees of that, but don't let that blow your mind. I would never ask you a trick question about that. I would just say bone marrow. Thymus is going to allow those T cells to mature. The T cells go to the lymph nodes, and then we get, well, they do have memory cells here. I didn't think they had it in this book. Helper T cells. Helper T cells will stimulate the B cells to create antibodies. Memory T cells remember the infectious agent. Suppressor T cells will suppress overreactions. Cytotoxic T cells are the ones that will actually go and punch the holes in the infectious agent, so it'll break apart and be eaten up. B cells will come down and form plasma cells. Okay. Now I've read that plasma cells actually provide the antibodies. Your book, I would never ask you the difference. Let's just say plasma cells. It looks like they've got both labeled as such. Are going to be the ones that create antibodies. Let's go with that. That's what I'll test you on. And then memory B cells will go to a side and hang out and keep a memory of that antigen so we can create antibodies quicker in the future. Phew! It's a chunk of change. If there's any questions about that, let me know. I think that the video that I provided for you is a great supplement as well. Here's the immunoglobulins and their functions. I think immunoglobulin G is one of the good ones to know. It's a main defense against bacteria and provides passive immunity. I mean, I think they're all good to know. I think E is good to know because that'll protect against, or it's what happens with allergic reactions. D will be with a blood serum. I hate lists of stuff. Let's go with this. What I want you to know off this slide is that G is the main defense. E is what is triggered with allergic reactions. An allergic reaction we're going to get into in just a minute or two is a hypersensitivity. Somebody who, like me, I'm allergic to grass. I was just out mowing the lawn, and of course I'm itchy and I'm starting to have this allergic reaction. Well, guess which immunoglobulin is starting to react? E, and I'm hypersensitive, so more of it is released than it would in somebody who doesn't have those reactions. Okay, so I'm not going to make you memorize from this list. I have other immunoglobulins listed in the rest of the lecture. Let's learn them one by one. But from this side, I want you to know G is the main one against bacteria. E is the one with allergic reactions. With acquired immunity, another concept is to know that there is active and there is passive. Active you get as you get older and you get exposed to diseases or a vaccination, and your body actually develops its own antibodies, and it's long lasting. You know, may take a few days to become effective, but then you have the antibodies against it. And this is how we build our immune system as we get older. Passive immunity is when we get antibodies from an external source. So for example, from mothers from breastfeeding. This is why breastfeeding is so important when babies are young, but that is short lasting, except for, you know, theoretically colostrum helps to give you a longer active immunity. But anyway, this is not something your own body's going to create. It's something you get from the external environment. And I believe you could get shots of it as well. It's that time. Which of the following are paired correctly? Physical barriers are part of the innate defenses. B cells are part of the innate defenses. T cells are the part of the innate defenses. Cytotoxic cells are part of the innate defenses. Which one do you think it is? All right, moving on. Alterations in immunity. The immune system is phenomenal, but when it goes bad, it goes bad. And the problem with that is the body starts to attack itself. As I explained previously, our body, as the immune system is developing, sends these little seeker cells out that tries out all of your tissues. And once it does that scan, your body then knows what tissues are its own and which are from the external environment. That way we don't attack our own tissues. Unfortunately, we get diseases where that goes awry and our body starts to attack itself. It can be mild, such as a hypersensitivity to grass, such as myself when I just went and mowed the lawn. Is that going to kill me? No, but I get itchy, my asthma kicks up, etc. All the way up to autoimmune diseases such as systemic lupus, which we're going to talk about. So these alterations in immunity is just where it kind of has gone a little awry. Let's talk about hypersensitivity. So sensitive. There's several levels of this. And what it is an inflated response to an antigen. Obviously, we understand it's going to lead to some sort of inflammation. Could destroy healthy tissue, doesn't always. If we're talking about some sort of hay fever, we're just going to get some swelling. We're going to get some itchiness, some redness possibly. Might not be bad. All the way up to autoimmune diseases, which can destroy that healthy tissue. Can be immediate or delayed. So the 4 types we're going to talk about, and I have them broken down for you in specific examples. Let's just get right into them because this is the same list as we'll be getting into. So type 1, immunoglobulin E mediated, which I mentioned before, is an allergic response. So when you have too much of that immunoglobulin E released, it will trigger, well, it's triggered from some sort of allergic response to the external environment. It can be local. I'm going to go back to the grass example. I was just out gardening. I was pulling things out. And whenever I rub certain grasses against my skin, I literally I always think I come in with poison ivy. I get these raised welts where the grass has touched my arm. Well, if it's dragged a little bit across my skin, it gets a little bit down into the epidermis and I get a local response. You got it. Redness, swelling, itchiness, praying I don't have poison ivy. To a systemic response where somebody ingests peanuts and they have systemic vasodilation, which will cause shock and etc. So it can be just local to a huge systemic response. It's going to stimulate T helper cells, which are going to stimulate B cells to produce immunoglobulins. Don't forget that the B cells are going to produce those antibodies, or those antibodies and immunoglobulins are interchangeable, okay? So immunoglobulin E is going to go around mast cells and basophils. It'll sensitize them. These cells release that histamine. Histamine is going to vasodilate your blood vessels. Cytokines and prostaglandins are proteins that are released locally or systemically if it's a huge response. Those will stimulate pain responses, itchiness. They'll draw white blood cells to that area as well, okay? And then at the next exposure, the antigen binds with the surface immunoglobulin, releasing mediators and triggering the complement system, which is going to be a much quicker response. And this is what happens when people are exposed maybe to peanuts once and they're okay, and then the second time it's a really bad response because there's a much quicker stimulation of the antibodies. They've developed memory cells against it, so there's going to be a quicker response, which we already learned. The complement system kicks into play, drawing more fluid and white blood cells to that area. Excuse me. Continuation. Hay fever, food allergies, anaphylaxis, due usually to food allergies or a bee sting or something like that. Inflammation and itching, the treatment, you guys know this. I'm going through the desensitizing injections. I'll let you know how it goes. Type 2, cytotoxic hypersensitivity. So this is going to be G or M type antibodies binding to the antigen on the individual's own cell. So it can be an internal or an external antigen with this. Recognition of these cells by macrophages triggers an antibody production breakdown. So lysis means to break down cells because of the activation of the complement system, and then phagocytosis will kick in to eat up those cells. So lysis just means to break down cells. It's usually pretty immediate. And examples of this will make sense, is a blood transfusion or erythroblastosis fetalis, which we'll talk about that's Rh compatibility, which you probably are familiar with. If a mother's incompatible with her child and blood crosses the placental barriers, that child's blood the blood cells can break open because the mother produces antibodies against it. We'll talk about that as a separate thing in the future. So RhoGAM is the treatment for that. If that whole erythroblastosis fetalis thing does not seem familiar, we will go over that in the future. But the treatment is giving the mother RhoGAM to help to prevent the creation of those antibodies. But blood transfusions is a very good example of this type 2 cytotoxic hypersensitivity, because if we give somebody blood who's not compatible, you'll actually break apart their red blood cells. Type 3, immune complex mediated hypersensitivity reaction. So antibody-antigen complexes, accumulate and are deposited in the tissues, usually kidneys, joints, skins, and blood vessels. This is autoimmune. So the complement system is kicked in, you get inflammation, you're going to deposit these. So what happens with antigen-antibody complexes, and if you have not watched the video that I put together for you, pause the tape right now and go look at it. You'll see how they are linked together with each other. You'll actually put little connectors between these viruses or bacterias or antigens, and you get these big conglomerations of them. Not big, obviously it's microscopic, but you lump them together, and the body does that because it's trying to collect all the infectious agents, whether it's bacteria or viruses, together so we can break it down. But with these autoimmune problems, these complexes build, you have the antigens linked together with these antibodies, and they can get stuck in the kidneys, the joints, the skin, or the blood vessels. I don't know why. Nobody knows why. If we knew why, we could treat it, unfortunately. And it says treatment is disease specific, but it's really symptom specific. So delayed hypersensitivity reaction, or 4. This is cell-mediated rather than antibody. So this will involve the T cells. An antigen will present. The T cells will actually come and respond with macrophages, and you'll get tissue injury and fibrosis. Transplant reactions, contact dermatitis, and TB skin testing are examples of that. Here's a chart. I don't know if this helps you or not. Once again, the questions I ask you will be directly from the notes, but sometimes it's good to have the charts just to sort of review and cover them up. That was a big thing for me when I would study, when I was getting my doctorate. I would cover things up and try to remember things off the top of my head. That's the best way you can study. And here is a question. Which hypersensitivity reactions paired correctly? 1, takes 1 to 3 days to present. 2, affects kidneys and joints. 3, deposits antigen-antibody complexes into tissues. 4, releases immunoglobulin E in the involved tissues. That is the end of our tape for this part. I'll see you in part 3 in just a little while. Let me know, of course, if you have any questions. Thank you.